Today we're going to look at a couple of Pilates principles that most people struggle with, namely pelvic placement, breathing, and our scapular mobilization and stabilization. Okay, so first of all, the breath in Pilates is confusing for a lot of people, but it's really quite simple. Usually when we breathe into the front of our chest. Now what this does is tends to create tension in our shoulders. So in Pilates we breathe in through our nose and we try and breathe into the lower aspect of our rib cage, on the back of our ribs. Okay, now what this does is bring more gas into the lower lobes of our lungs, so we have more efficient breath patterns, but also it draws our shoulders away from our ears, relaxing our trapezius muscles. Now the other part of our breath is our exhale. On the exhale, we usually use a resisted breath. It can be through a gently pursed lip, like you're blowing through a straw, or it can be a sigh, or it can be a blow. Some people just breathe normally as well. I personally think that that slightly resisted breath is better for your core muscles because it helps to engage the transversus abdominis. Now our transversus abdominis are those corset muscles that wrap right around our thoracolumbar region, and they work together with our pelvic floor or our hammock muscles, and they together contract everything in this abdominal area so that we restrict any unwanted movement. Okay, so let's look at that from a seated position. If you come to seated with your feet flat on the mat and your knees bent, I want you to try and get as close to your neutral spine as you can. So sat up nice and tall on your sit bones and relax your shoulders. From here, allow your hands to sit on your shins. Now we're going to inhale through our nose, pulling our shoulders away from our ears and breathing into the back of our rib cage. As you exhale, you're going to allow your hands to slide down your shins and curl your spine forward, bringing your nose in line with your knees. Now you're going to relax your shoulders away from your ears, and we're going to stay here for a couple of breaths. So inhale, breathe into the back of that rib cage. Feel your ribs expand out and up. As you exhale through that resisted lip, you're going to draw your belly button towards your spine, lift up on your pelvic floor, and feel your rib cage come down and in. Again, inhale. Exhale. Inhale, the rib cage expands into my back. Exhale, it comes down and in. Then my spine and my belly draw closer together. Inhale one more time. And as you exhale, I want you to stack your spine back up, one vertebrae on top of the other, sliding your hands back up towards your knees and lengthening your crown of your head away from your sit bones. Good. Now we can look at our pelvic position. So I want you to go ahead and lie down on the mat. Okay, we're going to keep our knees bent here and keep them hip distance apart. Now our hips are actually those little bones on the front of our pelvis that protrude slightly. They're called our ASIS. And then we also have another bone, which is our pubic bone. These 3 points together determine what is our neutral pelvis. So I want you to go ahead and put the heels of your hands on your hip bones and your fingertips on your pubic bone. And you're going to rock your pelvis forwards and backwards until you find that spot where your hip bones and your pubic bones are in the same horizontal plane. So if I were to come and put a glass of water on your belly, it wouldn't tilt one way or the other because it's nice and flat and horizontal. Now, depending on your posture and your body mass, you may have a space under your lumbar spine. Okay, not everyone will have this though, because some people are heavier or they may have a flattening of the spine. But for your neutral, pubic bone and ASIS are level. Now also in our neutral, we want to think about our ribs. Our abdominals connect into our rib cage and our rib cage connect into our spine. So we need to use our abdominals to control our spine from arching. So when we say lower your ribs or soften your ribs, we're meaning use your abdominals to draw your ribs back towards your hips and flatten them onto the mat. So all of the back of your rib cage is melting on the mat. Also your scapula, you want to feel your shoulder blades in contact with the mat, nice and relaxed, so that you're open through the front of your chest. You want to feel that nice curve underneath your cervical spine again. And your eye gaze is looking straight up at the ceiling. Okay, from here, you're in your nice neutral. We're going to test it. So I want you to go ahead and inhale, pick up your right foot and float it so it's horizontal with the floor. Exhale, lower it back down. Now you can slide one hand underneath your spine so that you can feel if your spine is shifting at all. And exhale, lower it down. And again, inhale on the right, pick it up, no shifting in the hips. Exhale, lower it down. You can also put your hands on your hip bones to feel if they're rocking or shifting as you pick up the left and lower it down. Good. Now we can look at the imprint, supported or braced position. Depending on what method of Pilates you use, it's a different term, but it's all basically the same thing. It's a position where we use our abdominals to reduce that curve in our spine so that we can melt our spine into the mat and protect our lower back when we're in an open kinematic chain, thereby 2 feet off the mat, or with a long lever, so the weight of our legs need to protect our spine from arching and hurting our lower back. Okay? So in that nice neutral, heels of the hands on the hip bones, fingertips on the pubic bone, we're just going to use our abdominals, our obliques on the side of our abdominal wall to draw our ribs closer to our hips and allow our pubic bone to come higher than our hip bones. So if you look at my 2 points, that's my neutral. As I exhale, I roll my ribs towards my hips and my pubic bone lifts up. Now, you also can use a little bit of your glutes, but it's not coming just from the glutes. It's simultaneously. Your ribs go towards your hips come towards your ribs, and that space in your back is now melting on the mat. Okay, so I'm going to rock back into my neutral. Let's try that one more time. Roll your ribs towards your hips. Allow your pubic bone to lift higher than your hip bones. And inhale, release it back to your neutral. Good. Now in that neutral, I want you to go ahead and tabletop your right leg. Now roll your ribs towards your hips, imprint or brace your spine in that supported position, and then pick up the opposite leg to meet it. So now your legs are connected, you're in a nice strong imprint, your transverses are on, your belly button is pulling towards the mat so that your abs are nice and flat. We're going to test this by inhaling and extending the front of the right hip to reach that leg away. Now only reach it down as long as you can maintain that imprinted position, and exhale to draw it back up. Inhale, reach the left leg away, and exhaling to draw it back up. Again on the right, inhale, open the front of the hip, tap the toe, exhale, draw it up. Now you may only be able to lower your leg this far before you lose that support in your lumbar spine. That's fine. The more you practice Pilates, the stronger your core gets, and the better you'll be able to control the movement in your pelvis in that imprinted position, and eventually move to doing everything in neutral. So as your strength increases, you can complete the same movement in your neutral without your pelvis shifting and without any strain on your lower back. Good. Now go ahead and lower your right leg down and then your left. And from there, I just want you to rock your knees to the right side and look towards your left. And then inhale back to center. And again to the opposite side and look to your right. And then back to center, just to release your hips and your back a little bit. Good, now we're going to look at our scapula stabilization. So you can go ahead and come up to seated. And I'm just going to show you how the scapula moves. So the scapula have only a very small bony attachment to our spine. Therefore, it has a lot of movement and mobility. So we need to work the muscles around our scapula in order to stabilize it on the back of the rib cage. Now a neutral scapula sits flat on the rib cage without any winging or upward rotation, downward rotation. Okay, so our first movement is protraction. Now what protraction means is these inner border of your scapula draw further away from each other. So if you have your arms long in front of you, when you inhale, you reach your fingertips away, drawing your shoulder blades away from each other, rounding and gliding them on the thoracic wall. Then you inhale back to your neutral. Now, retraction is the opposite of that, and we're going to draw those medial borders of the scapula closer together without pinching between the shoulder blades. And then back to center. So inhale, Reach the fingertips away, allow the scapula to glide away from each other, and exhale back to neutral. Inhale, retract, bring them closer together, and exhale back to neutral. Now you can see that I'm not shifting my pelvis or my spine at all. I'm inhaling to protract, and back to neutral on my exhale. Inhaling to retract, my ribs stay soft, and back to neutral. Inhale to protract, and then we can pass through our neutral and retract. So that's protraction and retraction, and we talk about that a lot, especially when we're in a plank position or doing any pulling movements, because we want to stabilize the scapula on the thoracic wall. The other movement we have in our scapula is elevation and depression. So for this, you can go ahead and put your hands on top of your head, and it's just a shrugging of the shoulders. So keep your ribs soft in your nice neutral. You're going to inhale, lift your shoulders up towards your ears. Exhale, drop them back to neutral. Inhale, shrug your shoulders without pinching or hunching, but just going straight up towards our ears. And exhale, gliding back down the back of our ribs to neutral. Now retraction or depression is a very, very small movement. So we're lowering our shoulder blades away from each other. And then back to neutral. I'm going to turn around so you can see that. So depression is lowering our shoulder blades down the back. So they come down and in, and then back to neutral. Elevation up, and neutral. Depression down, and neutral. Good. Now we also have upward and downward rotation in the scapula. So upward rotation, effectively, is when our scapula glide up and out along our thoracic wall, like this. And downward rotation is they come down and in along the thoracic wall. Up and out, upward rotation, down and in, downward rotation. Okay, now I find a nice way to feel the upward and downward rotation is just lying on your back. So come down onto your back and bring your arms up towards the ceiling. And we're going to do some arm scissors. So have your knees bent and in that nice neutral position, your abdominals are on and your ribs are soft. You're going to inhale, reach your arms opposite directions away from each other. And exhaling back to center. Inhale, reach them away. And exhale back to center. Now use those abdominals to control your rib cage from popping as you reach your arms away and back to center. Now if you can't maintain the abdominals without the ribs popping, then don't extend your arm back so far. Come up a little bit higher. And center. Last one on the right. Reach it upward, rotate on the right arm and back to center. And now upward rotate on the left and downward on the right. And back to center and lower both hands down. Good. Now I'm going to show you in a quadruped position how scapular stabilization looks. So if you come with your knees directly under your hips and your hands directly under your shoulders, your spine and pelvis is in neutral. Now if I protract, I push into the floor and allow my shoulders to round. Come back to neutral, and then to retract, I sink in the chest and bring my shoulder blades closer together. This is quite common for people to do in a plank or a push-up position. So we want to try and retrain our body to come back to that neutral position. So protract, and neutral, and retract, and neutral. Good. So I hope this has helped you to have a little bit of a better understanding of our pelvic positioning, our breath, and our scapular stabilization. So the next time you have your Pilates practice, you can incorporate these movements into your practice for safe and mindful body movement.